In this episode, we're going to get into how common low desire is, how it works in men, the common causes, and what you can do about it. So the statistics show that 1 in 5 men struggle with low desire, but most experts, myself included, agree that the number is much larger. But because there's that expectation that a guy's always supposed to want it, the self-reporting isn't as dependable. It's the same thing with erectile dysfunction, by the way. So that makes sense, right? Nobody really wants to admit, guys most of all, that things may not be working in the sexual department. But it's extremely common. And I've been a sex therapist and a love therapist for over 30 years. And I've actually seen an evolution and, in fact, a correlation between low desire and a new developing personality trait in guys that I'm going to reveal to you in just a little bit when we get into the causes. So 1 in 5 guys have it. And it's really tricky, right? Because you're much less likely to seek help as compared to women. It's very common for female partners, if you are in a heterosexual relationship, to take it personally. And then that cycles back to add even more pressure to the sexual discord, to your lack of interest. So let's get into why it happens. There are lots of reasons why a guy will start losing his sexual desire. The most common reason I see in men of all ages is medication. In particular, SSRI antidepressants like Prozac or Zoloft. Those are SSRIs, and they actually do, one of the common side effects is that they do inhibit sexual desire and even sometimes make it hard to get an erection and maintain one. That is actually related to the second common cause for low desire in men, is performance issues. So if a guy is having trouble getting it up or keeping it up or finishing, either he finishes too soon or he takes too long to finish, then he starts to get anxious about his performance. And if it's happening consistently, what he will tend to do is just withdraw from sex altogether rather than face feeling foolish or embarrassed if he can't perform the way he wants, or just not even wanting to think about the fact that he's not performing the way he wants. He just shuts down from sex in general and avoids it altogether. So another common reason is that he's got some performance issues. Another common reason that we do start to see in men as they get a little bit older, mid to late 40s, and definitely in the 50s and onwards, is low desire caused by diminishing hormones, in particular testosterone. Testosterone is a hormone that both men and women have, but men have a lot more of it than women. And it is the hormone of sexual desire as well as sexual response. So almost every man, once he hits his 50s, will have a decline in his testosterone and may start to see some symptoms like low desire and difficulty achieving and maintaining erections. And he will also have a lack of energy, kind of a lower general sense of well-being, a loss of muscle tone. Those are all really common symptoms of low testosterone, along with low desire. Another reason that men start to lose their desire, and this is actually, women automatically think this is the reason that their partner has low desire, but it's actually one of the less common reasons, is that he's not attracted to his partner. Either she's been so distant and shut down, or she has gained a lot of weight, or her physical appearance has drastically changed. And, the penis doesn't lie. I am not saying that if a woman gains, 40 pounds, you shouldn't still love her. But sometimes it's hard to get sexually motivated and attracted to someone who you're not physically attracted to. We're going to get into how to address some of these things in a minute. Now let's talk about one of the kind of newer reasons that I've seen, and this is primarily in men if you're like 35 and younger, 40 and younger. If you're in that age group, you have been raised during a time unlike your predecessors, where you're more in touch with your emotions. You're more attuned to your emotions. You're more affected by how you're treated, right? That's a good thing. But it can get tricky sexually, because if you're in a relationship with someone who's really being unkind to you or critical of you, or who you're fighting with all the time, or you just can't find a connection with anymore or at all, you're not going to be as sexually interested. Now, that used to be in the over 40s and 50-year-olds, you'll see that predominantly it's the woman who loses desire because of that, less often the man. But in this newer generation of men who have been raised to be more in touch with that and to feel more permission to feel their feelings, they also feel their feelings when their partner's mistreating them, and that can make them withdraw from sex. The final reason is, and this is kind of related to not being attracted to your partner, also much less common in the under 35-year-old men for similar reasons along the lines of how they were raised and educated, is if you actually are not attracted to women. So we see a lot of men over 50 who have been repressing or hiding, even sometimes from themselves, their sexual orientation, and that they really are either bisexual or pansexual or gay, and they didn't feel permission. They were raised in a very prohibitive environment, and they won't accept it in themselves, or they won't come out. And so often they will not be attracted to their female partners because of that. So that is really more the exception than the rule. We don't see that often anymore, but I did want to mention it. Now, what do you do if you have low desire? Well, one thing you could do is just ignore it, right? And let your sex life die. The problem with that is that your relationship very likely will die on some level too. That doesn't mean you're going to have to get divorced and the whole relationship will fall apart, but sex is a huge part of emotional intimacy and connection. It's what separates you from being roommates. And it's hard when you don't have the desire for sex to want to have sex, right? You may not feel distressed at the lack of sex, but you probably do feel distressed at the impact it's having on your relationship. So if you want to have more desire and or your partner is asking for more sexual contact, let's talk about what you can do to address the issue. Let's talk about it medically first. First of all, if you are on an SSRI or any medication that is even affecting your sexual function, or if you have a medical condition like diabetes or heart disease or anything that affects blood flow, that will also affect your sexual response, which will, like we said earlier, inhibit your sexual desire. So if you are taking any medications or have a medical condition that is negatively affecting your sexual response and or your sexual desire, and this includes the SSRI antidepressants, you want to talk to your doctor. Do not just stop taking the medication. That's a no-no. But your doctors, for instance, with the SSRIs, can either lower the dose if that's indicated or add in another medication like Wellbutrin, which has fewer sexual side effects. If you have a medical condition that is inhibiting blood flow, you may be a candidate for a blood flow enhancer that will help you with the performance, that will also play a positive role in desire if that's part of the reason you've been avoiding it. So those would be things like Viagra or Cialis or Levitra, all of which are called vasodilators. They basically promote the blood flow to the genitals and allow you to get an erection. And if you have a medical condition like diabetes or heart disease, you may not be getting enough blood flow to your genitals. So the Viagra will help that. If you are a candidate for that, obviously you need to talk to your doctor about it. Don't just take a vasodilator without discussing it with your physician. If it's about the performance, then some of what I already mentioned with the hormones and the vasodilators can help, but it also may mean that you need to alternate or change how you're doing things sexually. Maybe you need more stimulation. Maybe as you're getting older, where before you could get an erection, lose an erection, get an erection, lose an erection, all in one sexual encounter. Now, once the erection is there, you better use it or you're going to lose it and not get it back, right? So you can accommodate your sexual relationship to attend to the changes in your sexual response, which will create a lot more comfort and support your sexual desire. this does require that you actually have a conversation with your partner if you're in a relationship. And that really is step one, right? With all of these interventions. In fact, the research has shown that when it comes to men with any kind of sexual function issue, including low desire, if their partner is informed and included in the treatment, the outcome is significantly better. For several reasons. First of all, they'll support you through it. They'll help remember things the doctors are saying, but also they're getting educated and informed as well. They're not taking it as personally. And the two of you are on the same team working through the logistics of the problem together versus you secretly trying to fix it while she doesn't really know, or your partner, whoever they are, doesn't really know what you're doing. Now, if you are someone who has no desire because of relationship issues and the way you're being treated, then the only thing that's going to help is addressing the relationship issues. And my guess is if you're one of those people, you've already tried to maybe tell your partner, listen, I don't like the way you're talking to me. I don't feel like we're really spending any quality time together. I feel like you're displeased with me all the time. But if it's not changing, if your partner isn't hearing you, then go to a couples therapist. Make an effort to get the support you need. Don't just let those resentments fester, because they won't go away on their own. They will build over time and create a canyon between the two of you that will really put your relationship at risk. So if you're invested in your relationship and you want it to work, don't think that these communication issues will just go away on their own if they haven't already once you've said something. So step one is to say something and to try to talk about it in a non-aggressive way and in a loving way. And if that doesn't work, try it a few times. If that doesn't work, which let's face it, usually it doesn't because there are larger issues at play, then get the help of a therapist. A good therapist won't take more than a few months to get the two of you back on track in the communication department if there aren't huge betrayals between the two of you yet. And getting help earlier will avoid those huge betrayals. Now, to find a therapist can be an issue, right? Depending on where in the country or the world you live. But you can usually find an array of sex therapists, which is really what you want to be looking for. You want to look for a sex therapist who also has experience in couples therapy as well. And you can find those at ASECT, the American Academy of Sex Educators, Counselors, and Therapists, as well as STAR, STAR, Sex Therapists and Researchers. Those organizations have provider lists where you can look in your area of the country or the world and find a sex therapist near you. And I'll make a separate video, make sure that you check that out, about how to find a good sex therapist. But they can be, take it from me, unbelievably helpful and save you years of pain and discord if you just jump into it and get the support you need. So, long story short, low desire is normal in guys. All you have to do is see a physician around the medications and the medical conditions that may be in the way, and added on medications like vasodilators that may help, or hormones. You got to talk to your partner about what's going on and engage them in the treatment process. And you have to get the emotional relationship support you may need if there are relationship issues underneath the low desire, or maybe even as an outgrowth of the low desire that now are circling back to affect the connection between the two of you. If you like this video, make sure to subscribe and let me know in the comments if there are other topics that you want me to cover, because you know me, I'm always here to help you love and be loved better. And make sure to check out my podcast, The Language of Love, wherever you listen to your favorite podcasts.